Why do we collect blood for glucose estimation in fluoride containing vial? If you collect blood in a vial, the glucose will be utilized by RBCs, WBCs, and platelets through glycolysis. So, after certain period of time, once you centrifuge and separate plasma and analyze the level of blood glucose, by that time these cells would have utilized blood glucose. So there will be falsely low value of glucose. So to prevent that, we collect blood for glucose estimation in gray top vial. So there is color coding of blood collection tubes, which is explained in this video. Watch this later. Gray top vial contains potassium oxalate, which is an anticoagulant, and sodium fluoride, which is an inhibitor of the glycolytic enzyme enolase. So, glucose utilization by RBCs, WBCs, and the platelets is inhibited because of fluoride. So, we will get correct value of blood glucose when we use fluoride containing vial. Let me tell you a mnemonic. Remember this: EFG. E for enolase, which is inhibited by fluoride. So that is why we use gray top vial for estimation of glucose. Very easy, right? EFG. E stands for enolase, F stands for fluoride, G stands for gray top vial as well as glucose.